This episode is sponsored by Abe's Muffins, but more on that later. Welcome to the Food Allergy Brain. I'm your host, Mia Silverman, food allergy advocate, content creator, and master's student in clinical psychology. This podcast explores the mental and emotional side of living with food allergies through conversations with experts and people doing important work in this space. Before we begin, please remember that everything discussed on this podcast is for informational and educational purposes only. It is not medical advice. For questions about your own health, food allergies, or treatment, always consult with a qualified doctor or medical professional. I want to share an important content warning. Today's episode includes a deeply personal conversation about the loss of a child due to anaphylaxis, so please listen with caution and care. For today's episode, I'm truly honored to welcome Thomas Silvera, father, public health advocate, and co-founder of the Elijah-Alavi Foundation, a nonprofit created in memory of his son Elijah, who was tragically lost to a preventable allergic reaction at a daycare center in New York City. In this episode, Thomas shares the story of who Elijah was, how grief became the fuel for a powerful advocacy mission, and how that mission led to the passage of landmark legislation protecting children in childcare settings across the country. We also talk about the emotional complexity of navigating grief and advocacy at the same time, post-traumatic growth, what it means to tell a painful story over and over again in service of something bigger, and what Thomas wishes every food allergy family knew about managing fear without letting it take over. Without further ado, let's get into today's episode. Well, Thomas Silvera, welcome to the podcast. It's an honor to have you on here today, and just thank you for all you do for the food allergy community with your advocacy work. We really appreciate you. So just thank you for being here.
No, thank you. And I am truly honored to be here and speaking with you. And like I said, I truly appreciate it. So thank you for allowing me to have this platform with you to talk about my story, our journey, and why we do what we do.
Yes, thank you so much. Well, I'd love to begin, for listeners who may not know you yet, could you just share about who you are and what the work that you do?
Oh, yeah. No, definitely. Like I can tell you, well, first off, my name is Thomas Silvera. I am a father first, and, I'm also the co-founder of the Elijah-Alavi Foundation, public health advocate. I am a certified surgical technologist that people don't know about. My work today is rooted in the live experience after the loss of my son Elijah, and, to a preventable allergic reaction at a daycare center he was at in New York City. And, from there, my life shifted from the grief into advocacy. And now we focus on food allergy awareness, asthma awareness, education, and community outreach. And Elijah-Alavi Foundation was created in memory of our son. And at its core, it's about protection, education, and policy and community outreach to create change.
Well, I just want to first just say that I know you probably hear this a lot, but I'm very deeply sorry for your loss. And I can't imagine, being in that position, but I really admire how you've been able to turn such a, devastating, tragic, huge loss into something that's so impactful and going to be saving so many lives in honor of your son. So I want to just, acknowledge that. And so I really appreciate you being here and sharing that and just all the work you do. So I'd love to kind of get a bit, more with your foundation, the Elijah-Alavi Foundation. Can you just tell my listeners what this foundation is, what it does, and what it does?
Yeah, so the Elijah-Alavi Foundation was built off, the grief of the loss of our son. We started this organization in 2018. We actually started before we became an official non-for-profit in 2018. And the goal was to actually start the organization when our kids were actually born. It wasn't going to be named after Elijah. It was just going to be an organization named where we can, advocate and create awareness. But, soon after, we had to do something. So the Elijah-Alavi Foundation is created, and again, it's rooted in bringing policies and bringing change to food allergy education, especially when it comes to the childcare centers. Dina, who was Elijah's mother, in her grief, was able to look into policies in New York City and New York State and notice that there were no guided protections for children in childcare centers. only through K through 12. There's a voluntary guideline from K through 12, but nothing that actually protected the most vulnerable, which is child care center. So we acted on that and worked with our local legislators in putting together a policy that will actually protect the young children. So we were grateful for it, and in that kind of like spearheaded the organization, and also worked in that part in getting the law passed in 2019 and signed by the governor, which was the very first in the nation and the first in the country to have a mandate like that as such for childcare centers.
I can't believe that it's only like this is now a thing. Like this was never put into place beforehand. Like that is really, I had no idea that there weren't any laws prior to this.
Yeah. It's one of those things that you think about, that why wasn't a law like this put into place? And there's a lot of factors that can go into it, because there's a lot of regulatory issues that goes into childcare centers, who's governing it, and so forth. So it's still baffling, and that's why we work, tirelessly to create change across the country to try to close the gap for the childcare centers to have these protections in place to keep the children safe.
Well, the work you're doing is really important. We definitely need that for sure. So I'd love to go back in time a bit before November 3rd, 2017. Who was Elijah as a little boy? What was his personality like? What made him
Oh my
him?
God. Yeah. Elijah was such a phenomenal, young little boy. Him and his brother, I call them the dynamic duo, because they were like hand in hand with each other, and it breaks my heart even to this day to know that he's not with his older brother, Sebastian. So Elijah, he was full of joy. He was very independent as such for a young kid at his age, and he would just bring light just about him, and always smiling and always curious and full of energy. I will call him Choo Choo, because in the morning when he wakes up, you can hear his feet plop down on the floor very heavily, and then he starts running, so it sounds like a locomotive like coming from his bedroom. And I will call him Choo Choo, like a choo-choo train. And he's just full of joy, and he had this autonomy about himself that he wanted to do everything for himself and not look for help. And that was like that light he brought into every room. And him and his brother together, they would just that beam that just set a different energy for our family and for so many that was like in their presence.
Thank you for sharing that. I mean, I feel like that kind of embodies what your nonprofit is a light, is hope, and that's really beautiful. And so, he has had food allergies, and so what was it like managing that? Like, did you feel like you and your wife had a handle on these allergies, or was it very difficult? Like, what was that like?
No, I think I'm a food allergy. I have food allergies. I'm also allergic to medications. I'm an asthmatic. Elijah's mother, Dina, she also has food allergies. So we understood it. I understood the anaphylaxis part. I understood like everything that goes, like Elijah had not just food allergies, he also had eczema, he also had asthma as well. So with that understanding coming from us, we knew how to handle that situation. So we were able to kind of like manage it and mitigate any risk within our own household and also outside. So we were able to, remove foods from the house that they can have, foods that we would love for them to have. We also learned how to cook those safe foods for them as well. So it didn't like stop us in terms of managing the allergy. It's just, we just learned how to kind of like work around it, because all it take was like, we didn't want it to be like one mistake that changed the whole entire narrative within our home, or even working with family members and friends, having that understanding with them so they can manage, our children's food allergies within their own spaces as well.
Oh, I didn't know that you also had allergies. So that definitely makes it probably easier to navigate that as an allergy parent, because usually when parents have kids with allergies, they don't have allergies themselves. So that probably definitely made it more easier. So you didn't have to like learn or figure it out. You kind of already knew what to do pretty much, right?
Yeah, no, absolutely. Because it's like, even when the first time we had to administer epinephrine to Sebastian or administer epinephrine to Elijah, it's like knowing how to do that and not having that fear to give the epinephrine to them, save their lives, and that's one of the reasons why we keep pushing for these legislations because we want to remove that fear from the educators and from parents, especially when they drop their kids off at school.
Absolutely. And so, after, the tragedy that happened with your son, a lot of people who experience such a profound, big loss, retreat inward. And you did the opposite. You went to the opposite and went public and legislative almost immediately. What was that, like for you?
Wow.
Like, where did that come from?
It's honestly, I don't know where it came from, but I know for me, that drive came from the love and knowing that Elijah's death should have never have happened. And once that shock settled enough for me to breathe through it, and the same thing with Elijah's mom, is that there was this deep knowing inside us that could not allow his story to end just right there. I don't think anybody wants the loss of their child's story to end exactly where it happened. So we couldn't just like sit with the pain or do nothing about it. So while knowing other children could be at risk, in the same exact way, it wasn't about being strong. It was about being compelled. Like I felt compelled like towards the action because the inaction felt unbearable. So I knew that I had a voice. I knew if I had a story, if I had an opportunity to reach out to lawmakers, advocates, systems, managing how can we work around these systems, then I had a responsibility to do that. And I didn't want another parent getting a call from like their school and so with understanding that became the fuel, and advocacy became something of a form of love and emotion, as you can say, and it became a grief with a direction, you could say.
Wow, that's a great way to put it. I mean, I feel like, grief and advocacy are two very different, like, emotional experiences, and so having to navigate both at the exact same time is, a lot. And so, do you feel like, navigating this grief and then also advocacy journey, like, do you think it helped each other? Do you feel like at times it was harder at certain moments?
Oh, wow. I mean, they definitely do both. Like, there are days when advocacy basically gives my grief a place to go, when I'm dealing with it. And it also gives me a purpose, and it reminds me that, again, like Elijah's life still is impacting the world in a meaningful way. And on those days, like the advocacy helps me breathe. It helps me feel like, the pain that I'm feeling is being transformed into a protection. But there's also the days when you look at our grief and advocacy, can pull against each other, because advocacy offers require us to continue revisiting exactly what happened, right? So it's re-exposing the wound. And then we are constantly telling this story and then revealing details and explaining in depth the preventable nature of what happened. And also, like, we look at the caring and the emotional weight that comes from this, and going into rooms that don't always understand the depths of what we're carrying. So navigating both of the grief and advocacy is like learning that we can be committed and still be tender with what is happening. And I can speak publicly and still have private pain, and it happens all the time when I'm speaking in places, and I can advocate and still admit that some days it hurts deeply. There's days that I don't want to do this anymore, but I know there are days that when I wake up and I see my son's photo, or I see Sebastian, my other son Sebastian, when he calls me, I know I have to keep pushing past that, So I don't think the goal is to make grief and advocacy tidy in a sense. I think the goal is to honor both, honestly. I was like going through that. It's a heavy burden, with it, but at the same time, there's something inside that keeps pushing us forward.
I mean, I think that what you're doing is a huge act of love, like for your son and for both your sons, honestly, both for Elijah and Sebastian. I think that it definitely is really heavy and hard. And I think that it's important to like give yourself the space to also grieve priorities. I think I'm glad that you're able to like kind of have that balance. I think that's so important. Do you feel like, well, I guess I'll backtrack. There's a concept in psychology called post-traumatic growth, which is the idea that people can find meaning and transformation through suffering. Do you feel like this kind of describes your overall grief and advocacy journey, or how would you describe it?
I mean, yeah, I do see it like that. Like I do, like with care, I do. I never want the growth language to make it sound like the trauma was somehow worth it or acceptable. It's not. Like losing a child is devastating, and it's not a part of a life that any parent wants to be a part of. Like there's nothing redeeming about the kind of loss itself that we endure. But I do believe, like, when it comes to being human, it can create a meaningful, create meaning from what we survive from. And for that, it's like that meaning has to come through action, service, legislation, education, and community. And I have grown in ways that I could have never asked for. Like I've never foresaw myself being in this position today. I didn't ask to be here, but there is a reason why I'm here. And like I become more aware, more determined, and more compassionate, and more intentional about the work that we do, about the lives we can still protect. So yes, I mean, I do believe that it has been considered post-traumatic growth for us, not because of the pain that, disappears, but because I choose not to let the pain be the end of the story for my son.
Exactly. You're trying to kind of continue his legacy and honor him, and I think that's so important. I think that grief never goes away. It comes in waves. It kind of is, grief is just a really weird, complicated thing, and so I think that no one wants to be in the position that you're in with losing your son, but I really can admire how you've been able to use your story, your son's experience, as a way to create change in honor of your son, to keep his legacy alive and save more lives, because I'm shocked that this was not even a law or anything like this was put into place.
Yeah. Yeah. It's one of the things that is baffling to us, that such policies and legislation across the United States, we've worked closely with AFA in creating specific toolkits and everything, but when it comes down to the grief and everything, I remember a point in that part of the grief and finding out about the loss of our son, going through a phase psychologically, what they call tachyphagia, which, going through this moment of feeling like everything is moving fast or moving slow and not knowing where time is. So learning how to pull myself out of that type of mental state was challenging, because I knew I had to get back to a point where that dealing, trying to be there for Elijah's mom, trying to be there for Sebastian, and be there for myself. There was a part that I had to shut grief off temporarily in order to be in the moment, to make sure that Sebastian is protected, his mom is protected, and then once I had to shut it back on, that's still that heaviness that I'm still dealing with today.
Yeah, I mean, I'm sorry, I'm like crying. I'm very moved by your story, and you're really strong. Like that's really, really hard, you're really, even if you're not strong by choice, you kind of have to be in a situation, and being strong is exhausting. But I just thank you for sharing that, for being super open. Kind of going back to, because you mentioned kind of earlier in our conversation about having to tell Elijah's story to, like hundreds of times to legislators, the media, like even right now, like how, like, that must be really hard. Like, does retelling the story re-traumatize you? Like, how do you protect yourself emotionally when you have to do this in different settings?
I think I can start off first. Is like Elijah's mother and I, we saw this play out differently. I wasn't there when everything happened. Elijah's mother was there basically inside the in-depth of everything, because she was there while he was going through the anaphylaxis. She had rushed him to the hospital, and being there and being there in the hospital with him and seeing and hearing his last words. I was coming from work, and by the time I got to the hospital, it was too late. In that moment, it's like nothing felt real. everything just seemed totally blank. And when I go back to the tachyphagia, it's like that moment, nothing seemed real. It was something that I'm still trying to wrap my head around, because we're both two people who experience the loss of a child, but experiencing grief differently, and absolutely there are moments when telling Elijah's story feels like reopening something raw. Some days, like I said, I can tell you, it's with steadiness, and others days one sentence can't hit differently, like I'm telling you right now. Like, grief doesn't move in a straight line. The way I protect myself emotionally is by staying rooted in why I'm telling it. And it's my healing. It reminds me that this is not storytelling for attention. That's not why we have the organization. It's not about attention. It's not about being noticed. It's not about that. This is a testimony for change. And I also try to check in with myself. I see a mental health therapist because, if I'm depleted, I have to make sure I honor that by seeing someone. And if I need a moment, I can take it. And if something feels especially triggering, I can acknowledge it. And like support systems that come within this is like when you having like good people in your community, family members, having faith, having all these things, and honestly, giving yourself permissions to still feel human, literally, no matter what. Because advocacy doesn't cancel grief. If anything, it requires even more intention, emotional, with the care that comes with it.
Absolutely. I was just going to actually ask about how you cope with this. And I think that, it's so important to get that support and seeing a mental health counselor and having a strong support system. And, I wonder too, obviously this is more personal. We don't have to answer this question, but I wonder if this, has also brought you closer to your wife and to your son, Sebastian, and,
Like Sebastian, Elijah's mother and I, we're no longer together. We've been, grief plays a big, strong role into this. And that's another thing that people don't understand, how grief can affect relationship. But we are amazing co-parents with our son, Sebastian. We are amazing leaders in this space, and we run this organization as if this was our son, Elijah, Wow. So our support system is very important to us. Like I said, community is important. Like the faith is important. Having people around us to understand, like, that we are carrying both a mission and mourning at the same time, which is huge. So if you look at mental health, for me, it hasn't always meant in like learning to pay attention to my body and mind. And I get trauma lives in both. Sometimes that minor, like that means a setback if it has to happen. And sometimes it means resting, and sometimes it means quiet time. I think one of the biggest lessons we've learned from this is that you cannot pour from an empty place when your work is rooted in pain, because self-care is not optional, it's necessary while we're doing this.
Wow. Sorry, like regroup myself.
No,
I just
okay.
this is about your son. Like, I don't want to be the one that's crying here, but I think that it's so important to, take care of yourselves. And again, like the work that you're doing is so important. And I think that because there's such a strong, such a story behind it, not like a story because it's a real situation that happened, it's really heavy. And I just really applaud you for being able to, do what you're doing while navigating all this grief, and then having to co-parent. I'm glad that co-parenting has been a success, because that can be really hard when you go through such a big loss like this. So I'm glad that in that regard it's has been manageable. Just generally speaking, for parents that have food allergic children who live in a constant state of anxiety and just hypervigilance, what would you say to them about managing that fear without letting it consume them? Because you have allergies yourself, so you have that other perspective too, and you're also an allergy parent.
Yeah. No, it's, again, thank you for that about the grief and how, with family and everything. Like I said, we're great friends, to this day. We both moved on with our lives and everything, but it doesn't take us away from the mission and the love that we have put into this, So thank you for acknowledging that. What I can say for parents of kids who are food allergic children, whether, it's like, I would say, like, your fear is definitely valid. I know people say, let's not put fear into, having food allergies. It's like, but we're always going to have that fear, and we're not, you're not overreacting. I don't, letting parents, you're not overreacting. We're carrying real responsibilities. And that comes with an emotional exhaustion. Food allergy parent requires like levels of awareness that many people don't fully understand. But I would also say this is like, don't let fear become the only thing like your family breathe when it comes to having a child who has food allergies, whether it's EOE, whether it's FPIES, whether it's alpha-gal, whatever it may be. Be prepared, because absolutely, like, educate yourself, ask questions, advocate for your child, make sure that people know how serious this is, carry your emergency medication, build your systems, whether from support, but also allow yourself a moment of life, joy, and definitely breathe. Because fear can be useful when it leads to preparedness, but it also becomes harmless when it steals your ability to live. So, like, I would encourage like parents to build confidence through their education and their support systems, making sure you find the right resources that can help guide you and navigate you. Community is big. We have such a big community that people are not familiar with, and that's why we keep pushing the message out. The knowledge helps, practice helps. Like, you don't have to live careless, but you also don't have to live like completely consumed by this.
Finding that balance is kind of important.
Yeah.
That's a really great answer. I think it's also really helpful for allergy parents who are listening to this right now, because I think it can be so hard. So what you said, I think it's true. I think that it's normal. It's human to have those fears and concerns as it's your child, but it's also important not let it like take over, and finding that, as I said, balance. Thank you for answering that question. Thank you to Abe's Muffins for sponsoring today's episode. Abe's is a go-to brand for food allergy-friendly treats, whether it's everyday snacking or celebrations. They make mini muffins, cupcakes, brownies, iced cakes, and more. My personal favorites are the blueberry muffins and the mini iced cupcakes. They're all free from dairy, eggs, peanuts, tree nuts, soy, sesame, and even pea protein. They also have gluten-free mini muffins that are free from the top 9 allergens. What really sets Abe's apart is how seriously they take safety. Their West Nyack facility is dedicated free from dairy, eggs, peanuts, tree nuts, soy, sesame, and pea protein, so you can feel confident about what you're eating, because for Abe's, food allergies are personal. The real Abe was born with serious food allergies to peanuts, tree nuts, eggs, dairy, soy, and sesame. Tired of seeing him left out at birthday parties and school events, Abe's dad and uncle launched the Abe's brand and have been running it for 10 years. On top of being allergy-friendly, they focus on simple, all-natural ingredients, never using any artificial flavors, dyes, or yucky preservatives, creating treats that feel homemade, but the convenience and reliability of something you can pick up at the store. And moist, importantly, they taste good. Abe's has really cracked the code on allergy-friendly baking that everyone can enjoy. Whether you have food allergies yourself, your friend has food allergies, or you're just looking for a better-for-you sweet treat, you'll love Abe's, trust me. You can find Abe's at retailers nationwide, including Whole Foods, Sprouts, and Wegmans. Just look for the bright colored boxes in the bakery section, or check out their store locator online to find them near you. You can also search for Abe's on Instacart, which is a great new way to see what products are available near you. For New York City residents, you can also order them for delivery through Fresh Direct. Thank you again, Abe's, for sponsoring today's episode. Now let's get back to the podcast. So I'd love for you to walk our listeners through how Elijah's Law went from an idea to a signed bill in New York in 2019. It was 2019, right, when it was first signed.
Yeah.
And what did the process look like to get this signed? Because it's a long process to get these laws done. So how did that go?
Yeah, I always say it always looks easy when the law is passed, but the work, you have to, start the development of that in terms of, like, finding the right soil, looking, checking, making it sound like it, finding the right soil and the right seeds to be planted, right? Because on the ground, it looked like persistence, right? It looks like telling Elijah's story over and over again in rooms where people are needing to understand not just what happened, but why it should never happen again. So, and it also means by sitting with lawmakers, educating them, like with the educators from the first law that was passed, they had no knowledge of what food allergies was and what they could do, but we made it happen. So it's helping them understand the gaps in childcare and also making the case that food allergy preparedness in childcare is not optional. We've learned that it's an emotional work, but it also has to be strategic work. And it's meant by building relationships and identifying champions like you and advocates all around the country and staying consistent. And it also means for us is taking the grief and translating it into policy where the language could create real protection, especially with the most vulnerable of children. So a bill doesn't just become a law, right? It doesn't just become a law.
I wish it was. That'd make it easier, but
it would be the easiest thing, But it becomes a law because people keep showing up for it. People are advocating for it. And that's what the process looks like. Showing up, speaking up, and pushing forward and refusing to let the urgency be ignored. Because that's why laws like this exist. Elijah's Law exists because of people like you, the advocates, the organizations that support such legislation, because we don't want to see another child lost. We don't want to see any individual lost due to something that was so preventable.
And now you've had this law passed in 6 states. You've had it in New York, Illinois, Virginia, Maryland, California, and Arkansas, which all those things have very different political landscapes. So what's been the hardest fight to get this passed? Again, each state has its own different, political landscapes.
It's navigating this process. Again, it's a bipartisan bill. We have all the legislators, Democrats, Republicans, looking for this law to move. The most challenging one was California. California was challenging for us because we went in for the second time. The first time it passed both the House and the Senate, but the governor didn't sign it. And it wasn't because of the bill, it was because these entities involved didn't agree on a specific language. So we had to go back, and we waited a year before we reintroduced it. And we make sure that prior to submitting the legislation, we talked with these entities to make sure we're all on the same page when moving this bill forward. And we didn't really have to sit for a lot of community hearings or, to move this bill, thank goodness. But California was the most challenging one. New York.
That's surprising to me. You'd think that California would be more on top of their game, but I guess.
Yeah, they're very progressive, but, and I understand, the bill not passing the first time, there's an understanding. We went back and we made sure we gave it time before we went back to reintroduce it. And sometimes you have to give a little to get a lot back. And that's what we did. And, I'm grateful for that. I think our fastest bill that we passed was Maryland. I think Maryland, it was like a couple of weeks and it was signed into law, which was like, wait, okay. But like I said, each state brings its own challenges. Some are difficult because the political climates, some because of misconception around food allergies. Some people have this weird narrative of what food allergies are. Some because of the bureaucracy, some because of, urgency gets lost when lawmakers haven't personally experienced the issue. So one of the hardest fights I know are often ones that when you can feel that people care, that's one of the hardest fights. After that one, when people care, it's like, but they still don't fully understand the stakes that come from it. And I've sat in many meetings with that. So when someone sees food allergies are rare and manageable or personal family issues instead of a public health and safety issue, that becomes a barrier. So, and again, the other hardest part is often not just passing the bill, it's shifting the mindset. It's helping people understand that something like this type of prevention saves lives and that childcare safety should never depend on luck. And, although we passed 6 laws and we passed 2 city ordinances on top of that, so that gives us like 8 pieces of legislation.
Wow.
under the foundation belt. But we couldn't have done all these laws without these organizations that work with us and support and partnership with us. We couldn't have done it without the advocacy of these families and community leaders, coming forward and giving their testimony and everything. Like, we as an organization, we serve the community, and that is the very paramount of what we do. Is we're here to serve you because we are community, and we constantly stress that over time.
That's wow. I mean,
Yeah.
it's such
So
a
yeah,
journey. I mean, thank you for sharing that.
yeah.
I think the way you're
It's like
framing it. You go ahead.
it shouldn't depend on luck,
No.
when it comes to this. It's like it's a very important part of legislation that we're looking to push forward in every state as much as we can.
Yeah, I mean, it seems like the ultimate goal is to have this be like not like a national law. Like, what
Yeah.
would that realistically take, and
Oh
how
well.
far what do you think we are from it, and how can our my listeners help? Like, what can we do to help make this happen and
Wow.
help support this?
So right now, I think the step that we're taking, going state to state, has been easy for us to navigate, because we find the right legislator to work with, and we don't just let the legislator pick it up and then wait. We actually work hand in hand with these legislators. We set up meetings. We have an advocacy team, advocacy leaders that sit in these meetings and work with these legislators and see it through to the very end. If it doesn't get passed, we're okay with it. But it takes a lot because, again, when it comes to K through 12 and childcare, the regulatory systems are different. How K through 12, the Board of Education, Department of Education runs that, and different entities like the Children and Family Services, the Department of Children and Family Services. Then most of them run childcare centers. The regulatory systems, again, are different across the country. So how can they get involved? For the listeners, is like they can go to our website and look under Elijah's Law, send us a message via our website at Elijah-Alavi and we'll send you the toolkit that we created with Asthma and Allergy Foundation of America that literally breaks it down, like how to get this law into your state, and again, it comes down finding the right lawmaker to make this happen, because the ultimate, it's one of the things that we want to do with that.
And I think just being consistent, like you said, constantly showing up, like having people there to help, like amplify this. So that was really helpful. So I'll definitely link in the description of the podcast, like your website, as well as your social
Yeah.
medias and everything, so people can support, what you're doing, and then help participate, donate, be involved. I'd love to transition more just about health equity and just underserved communities. I think that's a serious issue in this country, especially. And you've spoken openly about just the fact that Black and Brown communities bear a disproportionate burden from food allergies and more severe reactions, more ER visits, less access to resources. And I think, it's obvious we have a strong history of racism in this country, but you as a person of color, why do you think this disparity exists, and how has it impacted you personally or those around you in your community? It's a loaded question. So
No.
but it's important.
It's a great question. Growing up, like, not to age myself, growing up in the late 70s, 80s, I'm 50 years old. Let's air it out.
I thought you were maybe like early 40s. No
I appreciate
way.
that. Yeah, so 50 going on 51. But growing up in that space, we're talking about health equity and the barriers that we face, knowing, growing up in a very impoverished neighborhood, especially dealing with, I was a chronic asthmatic and not getting the right access to care. It was constantly more emergency room visits than asthma management. So it's like, here's the medication and all right, good luck. That's what's the narrative back then. When you talk about disparities, I believe this, it exists because of the layers of inequity, and it's not just one thing. It's the access to specialists. It's the access to accurate diagnosis, and economic barriers plays a big part of that. Like, it's difference in education and awareness. Like, it's systemic issues in healthcare. It's environments where people may not be giving the culturally competent care, where their concerns are like taken seriously enough. there are lots of layers of information that can go into this, and I think this will have to be a whole new other podcast. But when those gaps exist, the outcome gets worse. When there's that access to care within these communities, you see more severe reactions, more emergency room visits, and less consistent access to management tools. Like I remember growing up when they started doing these home visits, like these community health workers coming to the house and helping my mom understand, management of asthma. But then that went away so quickly, and that's the problem. And they take away these resources to bring to these specific communities, to help them manage it. But then when it's taken away, you don't have that access to it anymore. So it's like, again, you see the more reactions in emergency room visits, and, this is why this work cannot just be general awareness. It has to be something that's equitable and access that the awareness is there and the care is there.
Yeah, absolutely. And I think that there's, especially in marginalized communities, there is a lot of disparities. And so I thank you for sharing that insight.
Just again, it's like when you're a grassroots organization, we do our best, to go into these communities and create the awareness and give them the access to resource. But we're just like, grain of sand, like with so many people that can do that. Our motto is, someone that taught us, like, don't just talk about it, be about it. When you want to give back to the community, it's great to highlight the statistical data. It's great to highlight this, but it's more about not just putting money into the community. It's like, are you really going into the community doing the work? Show us why this matters. Show us that you're changing the inequities that are in these communities and removing those barriers and giving them the right access to care and information that can actually keep them safe. We knew, like, these underserved communities, the Black and brown communities, though they have high prevalence that, with these comorbidities, and also food allergies and asthmas on that, based on the socioeconomical construct that is in that environment. Poor neighborhoods, it raises, poor health conditions. So how do we combat that? And it takes not just my organization, but multiple organizations to go in, like boots on the ground, to do the work.
And I think too, just eventually having to have just the system be changed. I think it's just a systemic issue too. I think that's the root cause is, and I think, the work that you guys are doing is hopefully going to help create that change, but obviously there's a need for that. So, what would it look like for food allergy advocacy space to truly center equity? Like, what's really missing? We kind of discussed a little bit, but there's some.
Yeah. Like I said, it will look like representation, access and accountability we talk about all the time. It would mean that the Black and brown families are in these underserved communities, and those facing economical barriers are not treated like an afterthought. And that's the narrative. Even I just read something. It's like, have COVID, impacted these communities? Are they getting the necessary needs, based on, funding and so forth? They're not. It's like, there was a lot of mention during COVID by helping these communities and giving them the right resources. But like, how many people have pulled back from that narrative and now no longer providing that, So it's like, when they're facing these economical barriers and not treated like, and treated like an afterthought, that there are voices that would be central and not peripheral if, these things would change. And like, what's missing right now is often the full acknowledgement that, when we look at food allergy advocacy, it's also a health equity issue as well. It's a public health issue. And we need more community-based education to build on that, like more culturally responsive outreach, more diverse representation and leadership, and storytelling. It's not just storytelling, again, to make yourself look good as an organization. It's like telling the story unscripted, in a sense, and more honest conversation about who gets left out, and and looking out at the traditional advocacy spaces. Centering equity for us means, like, not just asking how to spread the awareness, but asking who is it actually reaching, and not who is not reaching. We want to make sure that it's equity for all, and everybody has to stand on that same soapbox.
Absolutely. And do you think that, in your personal experience, like how have you seen that in the allergy like advocacy space? Do you feel like we're like really like lacking in that because you're in the nonprofit environment? Do you feel like it's gotten better over the years, considering, how your nonprofit is kind of addressing those concerns and gaps?
I think within, we're all in the same space, and we're all looking to mitigate risk before, until there's a cure. I think we're all doing our part, right? We're all doing our part, but funding becomes one of the bigger gaps. There's a lot of things that we do without funding. We go into these communities and do the best we can and give them the resources and access to that. A lot of organizations are doing the same thing, but we need to kind of like create almost like a bigger foundation of leadership to address these inequities in these communities, so where we can actually, again, help the community. And it's like statistical data reads to how many, people are affected by food allergies, how many kids are affected by food allergies. But there's a lot of people that are not listed in those statistical data. So we're looking at higher prevalence of food allergies that's not being listed, especially in these communities that are exposed to asthma and food allergies and other comorbidities. So it's like, until we can address these and see it and work on the same page. And I think, again, every nonprofit in the food allergy space has been addressing that, but it's a lot that has to be on the ground, boots to the ground, and doing the work.
Yeah, that makes complete sense. Thank you for sharing that insight. That's really I think really helpful to know. And I guess I could ask you this question, to talk more about the emotional reality of running a nonprofit. Like, what do you wish more people understood about the personal cost of advocacy, especially in your situation?
Like, we start a nonprofit, just because. We start a nonprofit for a cause. It looks like long days, it's like late nights, emotional labor that falls into all of this, and a lot of balancing. So years, it takes you years to build something from a place or a mission of pain. Some people, it's not out of pain, it's about a purpose. Like, there isn't really an off switch to this, and you're carrying the work and the reason why the work has to be done at the same time. Like I said, the sacrifice is real. The time and energy and rest is, the bandwidth that goes into it. So these are things that people don't always see behind the advocacy work, especially when a nonprofit work is rooted in the memory of a child. There's so many organizations out there that have lost their child through food allergies and start their own nonprofit because their mission is we don't want another family going through what we went through. And I understand that, and we feel that wholeheartedly. And, it's hard to say, like, that word commend them. It's like, it's such a bad word to use, but we all wouldn't be in this position, if we didn't see there is a space that is needed, and as much as we can put out there, we have to do it,
Yeah.
And again, a lot happens after the hours of why we do this, at the same time, it's purposeful work, and it's sacred work. So while the sacrifice is real, so is the meaning. There's so much that goes on. And like our organization, we don't have the financial depths of these big organizations, the financial funding that they have, so it's just like 5 of us that runs this organization. And we do it the best we can to make it, we're small but mighty at the same time.
Yeah. Yeah, you're making such a big impact. Like, I think that's a great way to describe it. And I think, especially the nonprofit you run, and the reason why you're doing it is definitely like emotionally taxing. And I know it can probably, there's days that are really hard, and I want, we, like us, I don't want to speak on behalf of everyone in the allergy community, but just myself, like, I'm just so grateful for what you do and just the lives that you're changing and the impact you're making, so people can feel safe and included in a world that's not built for people like us. So, like, I know that, like, there are days that are hard, but you're making a really big difference. And so I just, again, like, I could not thank you enough for what you're doing.
Yeah.
And, there's definitely probably had moments where you've wanted to step back because it probably felt pressure because you're also, you're also a student, you're also a doctoral student, which we kind of discussed before we recorded. But how do you balance not being a doctoral student and then running this nonprofit? Like, how do you balance all of that?
And, luckily, like everything is, I learned from an early point. It's time management. It's like how much time I give to the spaces that are needed. When it comes to the nonprofit, it always is always precedence over everything else, right? I make sure I manage out my calls, my meetings, if I have to travel. And then there's, but also at the same time managing, family life, and then managing my own personal space, but also giving the time to my education to finish up my degree. And I usually give that towards the evening time, like after hours, I call it, and, focus on that. So I've learned time management and learning how to move that process forward without kind of like going crazy at the same time.
It's a very important skill to have, is to manage your time. If you can manage your time, then I feel like you're golden. That's how I've had to figure out all my stuff. So I guess for this, these are more questions that are geared towards the food allergy community. What is the single most important thing that caregivers, teachers, and daycare workers that should know about food allergies that they often don't, that are listening to this?
I think, we talk about trying to remove the fear of understanding food allergies. That food allergies can turn to a life threaten very quickly, and hesitation can be dangerous. But to many people who still thinks that food allergies is just a preference or a mild intolerance or something like that, people
I wish it was. That would make life a lot easier.
No, it would make life a lot easier, but that's only because becomes serious if a child looks dramatically sick right away, and that misunderstanding can cost precious time. So like for caregivers, teachers, daycare workers to understand that anaphylaxis can escalate very fast, and that epinephrine is the first line of defense to save lives. So preparation matters, training matters, taking every allergy situation very seriously. And it's like with organizations like ourselves, it's going into these spaces and removing the fear and educating them on the understanding of anaphylaxis prevention and mitigating risk, and how for them to understand the signs and symptoms of these childs, and also understanding their narrative when they speak, their words when they don't feel a certain way, especially in the most vulnerable populations in childcare centers. You're talking about children from 0 to 4, even 5, who may not understand what they're feeling. So always take what they're saying seriously. Because if a child says my throat feels funny, or my tongue itches, or it feels spicy, those are key words that you can look for as a possibility they may have ingested something that could have created a reaction. So those are just some of the things for them to kind of understand, because there's a lot for them to understand. And I understand these childcare centers, they feel like they're being burdened with all this information and they don't have the tools, but there are organizations like ours that go in and give them the tool to remove the fear so they can act accordingly to save a life. Because when you look at it, even in the most rural areas, like first responders cannot come there right on immediately to administer epinephrine. So we have to look at the childcare educators and caregivers to be basically that first line for those almost like first responders to give the access to care. And I always say, child care equals healthcare at the same time, because you have parents that's dropping off their kids at schools with food allergies, with asthma, with diabetes, epilepsy, so many things. And it's like these childcare centers, they feel like they're burdened, but also we're trying to make sure that they keep our children safe the same way we would as a parent.
That's 100% true. I think it's a really great answer. And I think that you bring up a really important point about how if there's a child that is expressing that they are feeling uncomfortable, to listen to them, because they don't know what's happening, and as I said, anaphylaxis can escalate very quickly. It is life threatening. So I think that when in doubt, epinephrine is the first line of defense. So
yeah, just to kind of interject a little bit, it's also because children have their first reaction in a childcare center, unbeknownst to the educator, unbeknownst to the parent, that the child has food allergies. That's why we strongly put these bills forward to have undesignated stock epinephrine to have for these classrooms, for these childcare centers. So in the event of emergency, an educator can administer this life-saving medication to save this child's life. We're talking about children trying their first, a food that they never had that they could possibly be allergic to. So this is why this type of laws like this need to exist to prevent a tragedy or prevent something that can, cause harm to this child.
Absolutely. Absolutely. Well, that's absolutely important. So, what do you want people to remember about Elijah himself? Not just like the law of the foundation, but who he is.
Oh, wow. What I
It's
want
okay. It's
people to
okay.
know about Elijah is his joy, his smile, his innocence, his light. I want people to remember that he was such a beautiful little boy who was deeply loved, not just by his family, by the people that he met. He was not just like the name behind the law, the name behind the foundation. He was a child, he was our son. He was a life full of meaning. And we talk about it like Elijah, every time he felt sad or he felt nervous, he will always say these words, make a hand, make a hug, make a kiss, because that was his way of communicating like he needed that. So he was such this very heartfelt young man, little boy, my son. But he just embodies so much, and again, like I want people to see him. It's not about the law. It's not about the name of the foundation. It's about him and what he brings and what we can all do together.
He sounds like a really special kid. He sounds like a really special, yeah. Thank you for sharing that.
Yeah.
As not to transition, get off topic super quick.
No. So,
But, this is a question I think that is obviously, I think, so important. Applies to you, applies to your other son, Sebastian, and everything. And I asked this question to all my guests because this podcast ultimately centered around, the mental health side of living with allergies. And we kind of touched on that with your grief and advocacy journey, which is super relevant. And so if you could design the ideal emotional and medical support system for food allergy families and patients, what would that look like to you?
oh, wow. It will be about comprehensive. Comprehensive. It would include the quality allergy care, affordable medication, clear instructions, schools and childcare preparedness. Like mental health support is so key when it comes to that. Culturally competent services and strong community connections. Like families should not have piece together survival on their own, in a sense. You know what I mean? And I believe the ideal system would support the whole family, not just the diagnosis, because food allergies affect daily living and emotional health. So more importantly, also the financial stability, also providing school experiences, the social life, and also the peace of mind. Because family deserves a system that can see all of that and provide that to them.
That is a great answer, and I hope that we can one day live in a world where that is achieved and that happens. I think that's I feel like every time I ask this question, I always get kind of a different answer, and this is a really great perspective and outlook. So, Thomas, thank you so much for your time and for sharing, about Elijah and the work you're doing and how much such change you're creating in our country. I mean, all different states, obviously, and for the work you're doing to make people like me and people, young children, especially people in daycares, feel safe and have the proper protocols and things needed in case they're in a situation where they are going to allergic reactions. Just thank you for all you do for the food allergy community. For those that want to, follow you and support the work that you do, where can they find you and the nonprofit's social media pages as well as the website? So I can link it all.
Yeah, I think people can find us and support the Elijah-Alavi Foundation through our social media at Elijah's Echo on Instagram, on TikTok, on X platform, or find us at the Elijah-Alavi Foundation on Facebook. And connect with us, if you want to volunteer, support, donate, help with the advocacy and our community efforts. So, for support looks like, sharing our message, just getting the message out to create awareness and attending events that we have coming up or, partnering with us, it's just helping us amplify the mission that we're doing, because the work we're doing is to protect children and families and individuals. Because, we do this is not just for us, but we do it for the community that we serve, because that's where it's all rooted from.
Amazing. Well, thank you so much again, Thomas. And to those that are listening, thank you for taking time to listen to today's episode. I hope you all have a great day, night, wherever you're from, and I'll see you next time. Goodbye.